Today we're going to go over microneedling. If you haven't already purchased microneedle, you can purchase a microneedle by itself or as a bundle. If you are purchasing the microneedle alone, I would definitely recommend that you also buy the sterilising spray, as this is essential for the health of the microneedle and also for the health of the skin. This needs to be an alcohol-based spray of at least 70%. So bundles available on the website include your microneedle, your spray and a hydrogel mask. Or needles can be purchased from 0.2 to 0.45. What should we consider before doing microneedling? Well, a microneedle is actually piercing the skin at a very, very minute level. So your microneedle contains small titanium needles, and we're going to use this over the skin to create tiny little puncture marks that are going to stimulate a healing process within. This is not suitable if you have any type of acne, active acne. So if you have any pustules, any open wounds, then this is definitely not for you. You need to wait until your skin has healed, and the microneedle is fantastic for working on any scarring as a result at a later date. This is also not suitable to use on skin that has keloids. So if you have any keloid scarring, which will be a scar that's raised that you can physically feel, that could be a precancerous or malignant, then this is not a suitable treatment to apply to that area. You could use in other areas, but you must avoid your keloid scarring. If you're on any thinners that are affecting your skin, any medication, any cancer treatments, anything that you are unsure of, then please contact us and we can do a thorough consultation to make sure the microneedle is the best solution for you. However, microneedling is fantastic for skin. It's a great add-on to your home care routine to boost the skin naturally. So this is the way to non-synthetically boost our healing process of our skin. When we start to hit our 20s, our production of collagen, elastin and hyaluronic acid declines. And by using a microneedle and creating the small tiny puncture marks, we stimulate the collagen, elastin and hyaluronic acid production in our dermal layer. So this can help with fine lines, wrinkles, sagging skin, scarring, and also can just help with the general skin health. For home care use, we are recommending between a 0.25 and a maximum 0.45, and we would recommend that you start off on the lower and then build your way up over time. A 0.25, which is what I'm using today, we can use every other day. As we're going higher to a 0.35 and 0.4, then we will be doing this a maximum of once a week. Again, if you're unsure, then please contact us for a consultation. So before we start our microneedling, we're going to ensure that our skin, our hands and our needle are clean. Just remember that this needle is going to be penetrating small tiny pinpricks into your skin, so you want to make sure it's as clean and hygienic as possible. I have thoroughly cleansed my skin using All Medic's hydrating cleanser, which is really calming and soothing. So I've prepped my skin already to be nice and calm and non-irritated. Again, we will not use any ageless or any acid-based cleansers at this point. I have also washed my hands. And before we start, we are going to make sure that we thoroughly spray and cleanse our roller. I'm going to place it onto a clean tissue, and I'm also going to make sure that my hands and everything else in touch with the roller are clean and hygienic. We're also going to make sure that we obviously clean our roller at the end and place it into the appropriate package. So, how do we actually do our microneedling? Some people like to apply a serum before their microneedle, and this is just purely to give slip and glide. I personally prefer to work on a clean, cleansed skin with no product at all. I also tend to find that if it's the first time that you've used a microneedle, it's better off to start on the cheek area As the cheek area has got a thicker epidermis, you have more muscles under there and you're not so close to bone. Once you start to get into the forehead, then you're hitting the bone area underneath, and the neck is a finer skin and a finer epidermal layer, so a little bit more sensitive. So it's always good to sort of break yourself in a little bit. So I've used my microneedle now quite a few times, and I must say I'm absolutely falling in love with it. Okay, I like to be thorough and I like to cover the whole face at least 2 to 3 times. So we're going to start off with the cheek area and the jaw. So I'm going to start my microneedling in this corner, and I'm going to work down in an up and down motion. Now, not too much pressure, because you'll be able to feel the microneedles. And we don't want to keep going over the same area, as we don't want to just keep puncturing exactly the same spots. So I'm going to come in, and notice I've got my finger just slightly higher so that I can apply a little bit of pressure. And you can already see that my skin's getting that lovely little bit of pinkness about it. And I'm definitely going to work all the way to the edge. Now I'm going to work along the jawbone and along the cheek area in this direction. And I'm just dropping my pressure a little bit as I come close to the eye. I actually like to work close to the eye. It's one of my areas of concern. And I'm coming down. So in theory, I've now worked this area 4 times as I've gone back and forward. If you want to now, you could work in a diagonal across the opposite side of the face. Again, we're trying to avoid going over the same area in the same direction. As you're coming up to the bony areas, it's always good just to watch your pressure. And then next I'm going to work up the side of the forehead. I find this area here tends to get a little bit neglected. And then I'm going to come back to the middle of the forehead, and I'm going to work out just up and down. And then I'm going to work across, right at the top of the hairline, and then coming down right over the eyebrow. And again, I'm making sure I'm getting this area here where my crow's feet are. Let's not miss it out. And if you want to do a third, we could work in a diagonal in the opposite direction. And that's the most we're going to go over these areas. If we overstimulate the area, and if we are too heavy with our roller, we can actually stimulate the production of collagenase. And collagenase then actually causes damage to the collagen area and a breakdown of the collagen. So we start to have the complete reverse effect of what we're trying to do. Some people don't, but I like to work over my nose, at the side of the nose, over the lip and over the chin. So this is a little bit more tingly, and this is great if you've got open pores, any scarring in this area. I'm going to do both sides while I'm here. I'm just literally going up and down. I'm just going to treat the area once. Over the lip. Three times. On the jaw. Going down. The chin, sorry, and working back up. And then I'm going to start on this side of the face again. Start hand, and we're going to work all the way in. Now we're going to work all the way out. Make sure you get right to that very end and up into that hairline. And then we're going to work across. So underneath that eye, look at that lovely redness. That's what we're trying to create. And all the way down to the jawline. Now I'm going to work the opposite way. So I'm going to do a diagonal across the face. And back out. So I'm avoiding the lips. I don't want to puncture the lips. Just look at that lovely pinkness. You can still see that section where I haven't worked, and the neck and the difference in the area. So remember I said I like to work just a little bit on this fine line area, as I find it can be a bit neglected. And then I'm going to start from the centre and we're going to work out on the forehead. It should feel tingly and a little bit prickly. It shouldn't feel really uncomfortable. If for any reason it's feeling really uncomfortable, then please drop your pressure. Make sure you're not using it too heavy. If that's still not working, then stop using it and call us for a consultation. And then we're going to do an opposite diagonal. Okay, and then I'm going to work on the neck. You can also work on the décolleté. You can work on any scarring areas. If you're working on the body, you're going to go for a slightly deeper needle, as the epidermis here is a little bit thicker. Remember, the neck is a little bit thinner and a little bit more sensitive. So I'm literally going to work out on the neck and back on both sides. I'm going to pay a little bit more attention to underneath the jawline. Over time with the neck, you could start doing a diagonal or an up and down. But for the first time, you might just want to keep it limited to just forwards and backwards. See how sensitive you are. Don't forget to actually over the esophagus. Don't want to forget that area. And then if you are going to go out underneath the jawline, you can just work here if you want, or you could come down the neck if you're feeling comfortable, and all the way up again. Under the jawline. And then down the neck, and as low as you want to go. Like say if you're doing it in your bathroom and you've got nightie on or low cut top, then you can work all the way down to the décolleté. And I'm just going to do a little bit of a fan movement here, so I find that gets a bit neglected. So you can go over some specific areas if you want. So I tend to like to go over the middle of the nose. I've already gone over the sides as I'm working, so I'm definitely not going to go over there again. But I also like to work in these creases at the side of the face. So that's going to be my last area. Yeah, one, and I'm going to do a little fan here. So again, I'm not just repeating the same movements, so just out both sides. And then here I'm going to work specifically in that crease line. Up and down 3 times. And I'm all done. So I'm going to rest my microneedle on my clean tissue. I'm going to give it a really good clean and pop it back into its plastic bag when I've finished. But now I'm going to think about treating my skin. Obviously, the best time to do this is in the evening, so you're not going to be going outside and suddenly exposing your skin to loads of sun damage and environmental damage, you know, pollution, fumes. So in the evening is definitely my top tip of when to do. So this is a time now where you really could think about what you're popping into your skin. So stem cell, the Max creams, Max Cream, Max Serum, they would definitely be a must if you have got aging issues and if you're more concerned about fine lines and wrinkles. If your skin is more acne sensitized, irritated, then we'll be going with the All Medics, so we'll be calming and hydrating. We also have a hyaluronic acid, which is not an acid, but hyaluronic is very good for moisturizing the skin and plumping and boosting the skin. So we do have an image product that contains a high percentage, so that's a great serum to use after. And if you are more concerned about scarring, if you've got any deep scarring, dark scarring, then the Illuma range. So just have a little think about your serum that you're going to pop on after. So my 2 favourites to use are All Medics, which I just find is super hydrating and leaves my skin feeling beautiful, or my Vital C. So the Vital C is really good for hydration. It also is an anti-ager, so it plumps up fine lines and wrinkles. And the Vital C eye cream actually helps reduce wrinkles by 32%, so that's a goodie. So I'm just literally going to be applying a small amount of serum, about 5 to 10 pp's worth. I'm going to apply it in my hands, which are nice and clean and sterilised. And I'm going to apply it all over the face. I'm always telling people not to forget this small area. I'm going to just put a little bit more than what I usually would, because obviously I want it to really boost the skin. And I'm going to work down on the neck too. Now I'm going to leave this to penetrate into the skin. Do a few little raindrops if you want, just to make sure the penetration is going in. I'm going to leave this for a little bit, and then before I go to bed, I'm also going to either apply my evening cream, my nighttime cream, or I'm going to be using my Hydro Mask, and I can pop that on straight after my serum and really, really feed my skin. So a few different options for you there. I hope you've enjoyed this little video. If you have any questions, please feel free to drop us an email at inquiries@tonicdayspa.co.uk or leave us a message in the link and we'll get back to you. Happy microneedling!